Doctor, how do you envision NIH's role in the public-private partnership to combat antimicrobial resistance?
Certainly, this is a critical issue for drug development, and which has been successful in a long time to a certain degree in being able to head off the continual problem of antimicrobial resistance. And I fully support any research that can help us get to that aim for people. I'll also add that, like virtually everything we do in medicine, there is also a social and an educational component to this, right? So it's not just finding a new drug to beat the bug. It's making sure that prescribing practices for antibiotics or use in agriculture, all of these other efforts that really can make the problem worse and perpetuate the problem also need to be an area of our research to be able to combat.
Well, I thank you for that. Are there other new strategies that you could be looking at to improve clinical trials for new antimicrobial medications? Because I understand the last point you made, but I think we also need to make sure that we're continuing the research so that we have new classes of these medications.
Yes, thank you. This is a very important issue for clinical trials. I will also just take it as a side to say we have so much work to do in the clinical trials arena. And one of the other commitments I want to make is for clinical trials, since it's been one of my core expertise, that are faster, more inclusive, more responsive to the needs of people. It's one of the major initiatives that I'd like to see happen at NIH.
Well, I appreciate that. I just also want to look forward to working with you. I'm interested in bipartisan approaches to support innovative antimicrobial research, including through leveraging the tax code, and I really look forward to working with you and the rest of the department to achieve this goal.